Hi, I'm Dr. Marty Klein. Today I want to share an open letter I wrote to my doctor and yours. It's dated 18 months ago. Dear Doc, you did not ask me or talk to me about sex, not once. I saw you for hip pain. Given the way that so many kinds of sex involve our hips, asking about sex would seem important. You didn't. Of course, you're not alone. In 2018, I saw 4 different doctors, all very highly regarded with long waiting lists about my hip pain. Not one asked about sex. Eventually, I decided on hip replacement surgery. In our pre-op meeting, you didn't ask about sex. Later that day, I attended a mandatory 2-hour class at your state-of-the-art clinic. Various professionals, all very competent, experienced, very caring. They talked about everything we could expect after the surgery, about dressing, bathing, toileting, exercising, pain management, everything. Not one mention of sex. After the hip replacement surgery, very successful, thank you, I had lots of physical therapy, lots of occupational therapy. Again, I had the attention of intelligent, skillful, experienced professionals. It was great. They had lots of clever ideas about things like how to put on socks when I couldn't bend. They had good questions about rugs in the house or steps in the house or leading up to the house. They had no questions or clever ideas about sex. I don't think it's because of their prejudice about my advanced years, although that's no excuse either, right? After all, this lack of attention to sex is standard in every medical specialty. Infertility docs, internists, gastroenterologists, urologists, proctologists, yes, even gynecologists and pelvic floor specialists. I work with a lot of them. I'm a patient of some of them. They don't ask my patients about sex, and when I'm a patient, they don't ask me about sex. Dentists? The good ones will ask you whether you smoke, how much alcohol you use, and whether you drink soda. But they don't ask about sex. They don't even ask about kissing. Now, wouldn't kissing be relevant to your oral hygiene? In the medical profession, not speaking about sex is normal, and it's simple negligence. Some years ago, I was invited as a last-minute fill-in to speak at a conference of hand injury therapists. I had recently recovered from a fall with the help of a great physical therapist, and he thought I could share some insights about physical therapy from the psychological side of it. So I went to this conference at Stanford, and as I spoke, I of course thanked the organizers, and then I asked, have you ever noticed how crabby hand injury patients can be? Oh, the crowd of professionals, they loved that. They laughed. Yeah, a lot of those hand injury patients sure are crabby. Well, I really appreciate how you all talk with your patients about every aspect of daily living, I said. Now, how many of you hand injury professionals talk with your hand injury patients about masturbation? The room was as still as if it were empty. Ah, I said, why do you think hand injury patients are so cranky? I'm Dr. Marty Klein. Thanks for joining me.